Hi, my name is Richard Isaacson. I'm director of the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian. Today, we're going to be talking about endpoints in Alzheimer's disease clinical trials. An overview of clinical trial endpoints. So, when planning a clinical trial, we need to employ a hierarchy of predefined endpoints. What is our most impactful, most important endpoint to show efficacy or to show a change? Well, that would be the primary endpoint. Secondary endpoints are also helpful. They support primary endpoints. They can also show additional effects of the drug, but they may not be as impactful as a primary endpoint. Exploratory endpoints are also helpful, but they may not be interpreted as something that's definitive. An exploratory endpoint can include an important event that could occur infrequently, and they're basically honestly used to explore new hypotheses. Exploratory endpoints should be hypothesis generating. Now, when it comes to the domains of Alzheimer's disease assessment, we try to choose endpoints that speak to the areas of progressive decline in brain function. So, for example, we can think about cognitive function as an endpoint that we like to track longitudinally over time to understand the trajectory and then understand the impact of a drug or treatment choice on that trajectory. However, in Alzheimer's disease and other dementias, we also have declines in function, impairment in activities of daily living, and that could also lead to diminished quality of life. So, other domains of Alzheimer's disease assessments can include not just cognition, but daily function, quality of life, as well as behavioral or psychiatric outcomes, global assessments of change and function, as well as imaging or biomarker outcomes. So this is the spectrum of Alzheimer's disease endpoints that can be very valuable to understand whether a drug or not is efficacious in research as well as in clinical practice. So what are the challenges with endpoints in clinical trials? There's a term called clinically meaningful. What does clinically meaningful even mean? I think the tricky part about the term clinical meaningfulness is that it may be difficult to establish in certain patients at certain stages of the disease a meaningful outcome. For example, at the earliest stage of the disease, what are we trying to do? We're trying to maybe improve symptoms. But what if there aren't any symptoms? What if we're in the preclinical or asymptomatic stage? Then it can't be symptom as an outcome, but it needs to be delaying of progression of cognitive decline. That's not something that can be, easily noticed or easily apparent. It needs to be followed for a while. So again, how do you contextualize the term clinically meaningful? More evidence is really needed to support a correlation between biomarker measures and prediction or association with clinical benefit. So for example, if we can move the needle and reduce a Alzheimer's disease biomarker, does that actually translate into improvements in cognitive function, activities of daily living, or other clinical outcomes that are clinically meaningful in a person's life or the patient's caregiver's life as well? In a trial that needs to be oftentimes of reasonable duration, we need to demonstrate that a drug or treatment can permanently alter the course of a disease like Alzheimer's. But how do we do that? In a disease that takes 20 to 30 years to run its course or even longer, how do we have trials that run that long? I don't think that's necessarily feasible. So again, when it comes to clinical meaningfulness, this is a term that doesn't really have a perfect or clear definition. And depending on the individual outcome, the clinical meaningfulness of that outcome may vary quite a bit.